Hello, class. Professor Cisneros here. Week 8 wrap up. I'm going to make this a short video since this is the last week. As part of this, I'm going to be referring to some notes and in my screen. But in here, you were to list some ethical considerations that impact and influence the conduct of clinical trials. And then you all were to be making some suggestions. And I wanted to go over some of the suggestions and things for you all to be thinking about as part of these suggestions. As you all know, as project managers, you have to do a risk analysis on everything that, or at least you should, on almost everything that we do. And whenever you're making changes or making suggestions, the risk analysis does not go away and should be done on these suggestions as well. So I wanted to go through these rather quickly. So let's see. So the first one I came across, and these are generally speaking. Some of you had some slightly different ideas. These have come up in the past, and they came up here. So I wanted to address them in a general manner. So ensuring training, GCP training. In some areas, only the principal investigator is required to have GCP training. I absolutely agree that the entire staff should have GCP training. I would be very cautious of including a team where you have, it's a staff, the physician staff is also doing research in addition to all of their other duties. I have not had an experience where that has actually worked, where you've got a nurse who's trying to do all of her duties or his duties as such, and then coming back and trying to do research as well. That seldom works. And especially if they don't have GCP training, almost certainly your data is going to come out as a mess. Something kind of related to that is the consenting process and ensuring that subjects are appropriately consented. There's only so much we can do with that. There's only so much that you can do to ensure that the consenting process, that subjects are absolutely, positively consented. There's a level of trust that exists with the physicians, and this sort of thing occurs all over the world, up to and including the U.S. And it's not relegated to simply countries, poor countries, or third world countries, emerging countries. Whether or not a subject has an absolute understanding of the trial that they are consenting to is difficult. One of the things that could be done that wasn't suggested, but something I've done in the past, where I had concerns about how subjects were actually being consented, because it's really not part of any training program that I've seen. I'm sure somebody does it, but I just haven't seen it. But what I've done in the past is I actually created a video of what I thought was a good consenting process. So how should the study coordinator, or whoever's doing the consenting, whether it's the physician or an SC, consent a subject? And what I did was I created a video and put it online that all of the sites had access to at any time, so they could actually witness this. I played it at the investigator meeting, and so and of course answered all questions that were related to this. And all you can do is provide the training, have the monitors sort of review as best they can exactly what's happening, and then go from there. If you have an indication that subjects are not being consented, well, obviously that's a regulatory problem. Then you address that. Let's see. Investing in infrastructure. This can be very complicated. It sounds very good, but I still remember a time back in the very early 2000s where I went to sites here in the U.S. and the study coordinators bragging about all of the equipment that sponsors would provide them. So if they needed, in order to participate in the trial, a minus 70 freezer, sponsor would send them a minus 70 freezer and then never recollect it. I saw freezers, refrigerators, refrigerated centrifuges, regular centrifuges, all kinds of equipment like that. And at some point, the FDA stepped in and said, you know what, that's considered to be compensation. And so it was at that point, it needs to be treated as such. And so at that point, then either it wasn't provided at all, or it had to be recollected at the end of the trials. I did a trial many years ago where we provided treadmills. These were hospital grade treadmills, and they ran about $5,000 a piece. And we had to get them back unless the site wanted to purchase them, which some of them did. As far as providing infrastructure in other countries, that needs to be thought about as well. What are the local regulations about that? Are you going to maintain this infrastructure? For how long should the sponsor be responsible for maintaining this infrastructure? Are you talking about just buildings? Are you talking about equipment? Are you talking about personnel? Because all of this could be possibly related to infrastructure, and it's all required in order to do this. So there just need to be a lot of questions that are asked and answered. There needs to be a review of the local regulations, all of the guidelines that are associated with potentially providing infrastructure. And once all those questions have been answered to the satisfaction of the team, then you can decide to either move forward or not. Oversight and regulatory oversight, additional regulatory oversight. If there is poor regulatory oversight, is somebody not doing their job as a regulator, or are there gaps in the rules and regulations and guidelines as it relates to oversight? So before there is encouragement to create additional regulations, look at what's existing and find out if somebody is simply not doing their job, or is there something that is not being done along those lines, and then possibly there could be additional oversight if there is concern about the manner in which sites are conducting themselves. Then and there is a decision for the sponsor to go into these countries and go and utilize these sites, then there probably needs to be a lot more oversight by the sponsor. More frequent monitoring trips, there could be audits. There's a number of other things that need to be, that could be done. So before there's encouragement to add additional regulation, take a look and see where are you with the existing regulations. Let's see, there was an idea of possibly obtaining consent from community leaders, health authorities, heads of household, as well as the subject before allowing them to participate in the trial. There are a lot of potential logistical issues. You're doing something like that. Are the community leaders and local health authorities going to be willing to take responsibility for providing consent? Are they going to have the resource to spend the time to be providing consent? Quite frankly, this is likely to result in nobody being enrolled in your trial. Let's see, payments. There was questions about payments to investigators as well as subjects. That might be it wasn't phrased this way, but essentially where you're going with this is that be coercive. If all payments were taken away from investigators and subjects, you wouldn't enroll anybody in your trial. Now, having said that, part of what the EC's and IRB's responsibility is to ensure that payments to subjects are not coercive. If you are doing a simple 2-month asthma study, it would be considered coercive if, say, you were paying somebody $20,000. It's just too much. So part of because a subject is going to be willing to risk their life for that kind of money, and that's the part of it that makes it coercive. As far as payments to investigators, there are obviously guidelines in different countries. Every country has its own guidelines in respect to that, and so following those guidelines is very important. But for the most part, I've yet to see where somebody was willing to pay investigators an excessive amount of money. Now, that's not to say it doesn't happen. I know that it does. I haven't seen it. I've read about it, and yes, the regulations are in place, but to eliminate payments altogether, you wouldn't find anybody who was willing to do that. So while we would all like to be very altruistic. It's just to ensure that everything is above board. It's just not practical in order to do so. Finally, let's see. Pay for subjects' health care, whether it's related to the study or not. This is another area that, again, we would all like to be altruistic, but how practical is it? And there needs to be a risk analysis of what can potentially happen. I know that in Argentina, I was going to be doing a study. I did a study in Argentina a number of years ago, and there was legislation that was going through that said that, and this is going to be true of India, and I think a number of other places up to, and including Brazil as well, where the sponsor was going to be responsible for a subject's health care and all health issues that were related or not to their participation in the study. And it's very easy to see how either an undiagnosed issue or possibly a diagnosed issue comes in with the subject, or a subject presents themselves with such, and now the sponsor is going to be responsible for possibly providing health care for that subject for the rest of their lives. It's just not practical. And where does the responsibility of the sponsor end and begin? Now, if the team is willing to take that risk and is willing to do this, that is one thing. My point is, when a proposal like that is made, an idea like that is presented, the risk analysis needs to be done, and it needs to be looked at every angle. So that way you, as a leader of the team, needs to be knowledgeable about what could conceivably happen. And if it does, what are you going to do about it? Or is the sponsor willing to take on those healthcare needs and the cost of that? And not potentially for just one. This could happen, depending on the size of the study, this could happen numerous times. So take a look at that, and always be thinking about what are the consequences of these decisions, and ask every question that you can possibly think of. Something that came up also that I like very much was cultural training. Actually, I had a meeting 2 days ago with a group, and this came up. They were doing oncology studies in Eastern Europe and Asia Pac, and the idea of cultural sensitivity came up, and how do we train for it, and the importance of it. And I think that cultural training, if you're going to be doing international studies, is indeed very important. There are many cultural groups that are very sensitive, and it comes across as being very respectful, and you're much more likely to have a positive outcome if there is a level of cultural sensitivity on behalf of the sponsor. And something else I wanted to touch that is related to your respective roles in research, especially as research leaders, as project managers, associate directors, and whatnot, is you're going to have there's going to be a lot of social interaction with many of your sites and many other teams. This came up, this has come up a number of times in a number of meetings that I've had recently. And that is, oftentimes these social encounters, you're at a conference or you're at an investigator meeting, and they always have some kind of social hour or two, and involves drinking or involves alcohol. And I just want to caution you, it's something that came up. Like I said, I had this discussion with an executive, and between the two of us, it was rather astonishing how many people we knew that had overindulged, shall we say, had too many, and their behavior resulted in them either being sent home, and sometimes as much as losing their jobs, or being reprimanded. And unfortunately, those kinds of events, because we work in such a small industry, it seems like it's quite large, but especially in certain areas of the industry, you're only 1 to 2 degrees away from knowing just about everybody, and those sorts of events do not often carry and do not go away. I know of people who have not received jobs because of an incident that somebody remembered or had heard about that had occurred 10 or 12 years earlier. And so those kinds of things stay with you. So I would caution you, while it's important to have those sorts of social encounters, and having a glass of wine or a beer or something is completely appropriate, never lose your professionalism. Even at the end of the day, if you're still going to be meeting the following day, people sometimes, if you overindulge, you're going to, and you don't get enough sleep, you're going to look terrible. You're going to, a lot of people will actually continue to smell of alcohol, and people will lose respect for you because you're not reflecting the professionalism that they expect. So always keep that in mind when you're at a sponsor or a CRO sponsored event, and you're meeting with coworkers, or you're meeting with sponsors, or you're meeting with if you're meeting with anybody at any event, whether it is even at a conference, always keep that in mind. Never lose your professionalism, especially even at you go out to dinner with your team and maybe 5 or 6 people. I still remember the first time this happened to me years ago, when I was a senior lead on a study, and I was out with my team. There were about 12 of us, and without exaggeration, everybody was looking at me as we were staring at the menu to see if I was going to order alcohol or not. And when I ordered a glass of wine, everybody knew it was okay, but I always limit myself to 2, and I would suggest that you do the same, since you're always able to still maintain your composure and yet still maintain that social atmosphere. So with that, it has been a pleasure interacting with all of you and reading your respective work. And if you ever have any questions, I'm on LinkedIn. Feel free to reach out to me or text me. And have a great career. Thank you.